Theater, Ramona.
Welcome back to the Valley Connection. With me this evening is Carol Wood, who is the CEO of Visiting Nurses Association. And welcome, Carol. Glad to have you with me.
Thank you.
This is a great organization. Probably one of the most caring nonprofit organizations we have in our valley. Let's talk a little bit about, you're very closely connected to hospice. So let's talk a little bit of difference between what is Visiting Nurses Association, what is hospice, and how do they interrelate?
Okay. Ramona VNA Hospice has been servicing the community since 1987. It was a community idea. Dr. Joseph Karcher was very involved in the original group that put the hospice together. And it originally started as Hemet Hospice. And Hemet Hospice volunteers came together to provide hospice services in the community. And early on, they realized that in order to get paid through Medicare, they had to start a separate company, which would be the VNA side, in order to be able to bill. Because you can't be in business if you can't get paid. And so with that, we started the home health and the hospice to provide for services for both the chronic end-of-life folks and also people with acute illnesses that need services in their home. And so there's both sides of our agency, and we're supported by Hemet Hospice Volunteers, which is our foundation. They help to raise in the millions of dollars to help put services back into the patient care that we provide. A couple of the other things that are very important to us is giving back to the community, not just in the way of patient care, but also community education. And so we provide a number of speakers bureaus. We have developed podcasts on our website with educational material having to do with a variety of healthcare issues, so that folks can actually go on the internet, look at the podcast and listen and learn about things that might be important to them. And then finally, we support and provide a lot of health fairs in the community, both at some of the senior communities. There's probably a health fair going on at least once a week where we bring vendors together who service particularly the senior population to give them education on services that are available to them in the community, including home care and hospice care.
Well, education is key, I know, to knowing, what services are available out there. And speaking of services, I know there are other agencies, right, that take care of maybe hospice type. How are you different from other agencies?
Well, that's a good question. There's a difference between a not-for-profit home health and hospice agency, which is Ramona VNA Hospice, and a for-profit. With a not-for-profit agency like ourselves, certainly we need to raise money, we need to make money per se, but every penny that is earned goes right back into patient care. We don't have shareholders to keep satisfied. We have patients to keep satisfied. We're the only community-based not-for-profit that's actually located in the valley. There are probably 5 or 6 agencies that service the valley, but we're the only not-for-profit that's actually located in the valley.
So your specific service area is in
Southwest Riverside County. We service Sun City, Hemet, San Jacinto, Beaumont, Banning, all the way down to Canyon Lake, Lake Elsinore. Our primary service area is probably Hemet, San Jacinto, and Sun City, but I think we're the only agency currently that's going up to Idlewild, Anza, and Awanga. And what's important for the patients is that our nurses live in this community, and they're on duty 24/7, 365. So if a patient needs something in the middle of the night, they're not going to get a phone call from a nurse. They're going to get a visit from a nurse.
Wow, I think that's pretty incredible. You don't see that much anymore.
Well, I'm not aware of any other agencies that actually have nurses on duty during the night, but our nurses, we have at least 2 nurses on duty every night, and they're spending their night going from home to home, fielding calls. If it can be handled over the phone, most certainly, but they will go to the home and work with the family. They'll go pick up medications if they need them in the middle of the night, if something needs to be changed. Makes a big difference to the family.
How severe does a patient have to be to receive this service? I mean, do they have to be a terminal type patient, or is it just somebody that has a severe illness, how does that work? And how are they referred to you? Can a person just call, or does it have to be through a doctor?
Well, the service needs to be provided under the care of a physician with physician orders, but to access our services, there's a variety of ways. First of all, for hospice care, patients need to have a diagnosis where it's expected that if the disease follows its normal course, they probably would not live longer than 6 months. Now, we do have some patients that are on hospice for longer than 6 months, so it's not absolute, but in the scheme of things, it should appear that if the disease was to progress under normal circumstances, they probably have 6 months or fewer till the end of their life. And that's one of the criteria that's very important. But to access our care, they probably are already under the care of a physician, but maybe not. They can contact their physician who can make the referral. They can call us directly, and we can have somebody speak to them, help evaluate the situation, and we can make the call to the physician ourselves. Another way to learn about our services is actually to go to the website. I know you hear, that just seems so funny that,
you know what?
that we'd have a website, but by going to the website, they can learn about the difference between hospice, home health. They can educate themselves on services that we provide, and then they can contact us, and we can actually have someone come to the home and speak with them and help them either get referred to services in the community that are more appropriate for them, or possibly get the referral that they might need for hospice or home health care.
Who pays for these services? I mean, does the patient have to, how does that work?
Well, for hospice, hospice is a Medicare benefit. So for patients that are eligible for Medicare, that is 65 or older, there is a hospice benefit, and if they meet the criteria, and the criteria has been established by CMS or the federal government, but if they meet the criteria for hospice, all the services related to their hospice diagnosis are covered under that benefit. If they're under the age of 65 and not eligible for Medicare, most HMOs do have a Medicare benefit, so it would be the same way. It would be covered under their hospice benefit. Those things related to the hospice diagnosis would be covered under hospice. And in our case with the foundation, if there are other things that they need that aren't covered under their benefit and they can't afford them, our foundation is so generous to help to pay for additional either medical supplies. They have paid for caregivers. We had a gentleman that needed an air conditioner. In the summer it was so hot, and he was on our hospice program, and Hemet Hospice volunteers graciously paid to make sure an air conditioner was installed so that this gentleman could be comfortable
incredible, Carol.
at the end of his life.
You know what, we only have just a few seconds left, but I wanted to mention briefly, you have some very special doctors that have received some outstanding awards.
We do. Dr. Leslie Stevens and Dr. Leslie Cochran, we jokingly say that you have to be named Leslie to be a doctor at our agency, but both of our physicians were awarded awards. The State of California Physician of the Year, Dr. Cochran received the Physician of the Year for Hospice in 2006, and just last year our own Dr. Leslie Stevens received the award for Hospice Doctor of the Year for 2008, and we are so very proud of them.
I mean, that's incredible, and have them right there in your own staff.
That's exactly right.
Unfortunately, we're out of time. Carol, thank you so much for being with us, and I'm sure if anybody out there has any questions, contact your office.
Absolutely.
Right? And the phone number is?
That's a good one.
Okay, we'll put it on the screen. Thank you very much, Carol, and we really appreciate you being on the show with us and
Thank
giving
you.
all this great information. Please don't go away. We'll be right back with more of the Valley Connection right after this.